Welcome back with spring in the air. Many of us suffering from pollen in the air. Allergies certainly not pleasant. Joining us today to talk about how to care for our eyes during the allergy season, Dr. Brent Reed from Griffin and Reed Eyecare. Dr. Reed, welcome. What is the most common problem you face this time of year with eye problems?
Well, one of the things that we really have a lot of problems with this time of year, in fact, we probably have 6 to 8 phone calls every day in the office or from people who are suffering from itchy, burny, stinging eyes. And that's mostly due to exposure to allergens in the air this time of year. That's particularly common when we have hot, stagnant days like we've had lately.
What can you tell people, and there's allergies are such a big problem in the valley, just eye drops or to limit problems that you may be outside in dusty areas?
It does help to limit your exposure somewhat, but most of us don't have the luxury of doing that, especially those that work outside or need to go outside to play or whatnot. Most of the time, the oral medications that people use don't have a great effect on their eyes, so there are a number of eye drops that seem to help. Artificial tears being the most simple and easy thing to purchase and use, but there are better antihistamine eye drops, most of which unfortunately are prescription strength.
Doctor, with allergies, is it something that you just have to deal with, especially with eye problems, or is there a way to beat them?
Well, unfortunately, you can desensitize yourself somewhat to allergies, but as you mentioned, the valley, the Delta River Valley, is considered to be the allergy capital of the United States by most people in medicine, and as a result, it's very difficult to desensitize yourself to everything. So usually the typical and most the easiest thing to do is to treat the symptoms with an antihistamine, either in the form of a pill, if it involves the nasal and oropharynx, and to treat the eye if it involves the eye and the tissue, the white tissue of the eye.
Now, doctor, we're moving into the harsh sun part of the summertime, brilliant sun, and we know that UV rays are harmful to the skin. What about to the eyes even if you are wearing sunglasses?
Well, one of the things that you need to be real careful of, Walt, is that you wear appropriate sun protection both for the skin but also UV protection for your eyes. Your eyes are a very sensitive organ. There are several things that can happen that are very negative if you don't protect your eyes. It's more of a cumulative dose over time, not such necessarily an acute thing like a sunburn, but small bumps on the white part of the eye develop, and those can grow over onto the clear cornea, obstructing vision. The development of cataracts over time, which is a clouding of the lens inside the eye, is very much related to exposure to ultraviolet light over the years. And we found in the recent past that macular degeneration, which is the leading cause of untreatable sight loss in people over the age of 60 in this country, is mostly related to the exposure they have to ultraviolet light in their youth and growing up. So it's very important to wear UV blocking sunglasses. And in fact, Walt, it's better to make sure that those glasses do have UV protection. You're better off not to wear a pair of sunglasses if you're not sure if they have 100% UV.
How do you know, doctor? You can buy sunglasses at any convenience mart these days. How do you know if they're UV?
All good sunglasses will have it clearly marked on the frame and or the lens itself that they're 100% UV, or sometimes it will say UV 400 or full UV A and B. In fact, if it doesn't say that, I would advise that you don't purchase them. Now, most good brands, expensive brands of sunglasses are 100% UV. However, some of the less expensive, less well-known brands that are $10 to $25 are also 100% UV, but it should be clearly marked.
Okay, doctor, we thank you. Nice chatting with you. Thanks for your help, and we'll see you next time.
Thanks, Walt.
Okay.
See you again.